Following are the parts of the fallopian tube from uterus to the ovary except fundus. So which are the parts of fallopian tube from uterus to ovary? Ampulla, isthmus and infundibulum. Nerve supply to the perineum is pudendal nerve. Blood testis barrier is formed by Sertoli cells. Branch of internal iliac artery is superior vesicle. Which of the following is related to third part of duodenum? Superior mesenteric vein. Not seen in colon. Peyer's patches is not seen in colon. Tinea, sacculation and appendices is seen in colon. Renal papilla opens into minor calyx. Space of Dissay is seen in liver. Appendicular artery is a branch of ileocolic. Neurovascular plane in anterior abdominal wall is between internal oblique and transversus abdominis. Which nerve supplies celiac plexus? Greater splanchnic nerve. Right hepatic duct drains all segment except third segment. So right hepatic duct drains fifth, sixth and seventh segment. Lymph from glans penis drains into deep inguinal lymph node. In bladder injury, pain is referred to all except flank. So in bladder injury, the pain is referred to upper part of thigh, lower abdominal wall and penis. Testicular lymphatics drain into para-aortic lymph node. Nerve root of pudendal nerve is S2, S3, S4. Urogenital diaphragm is formed by all except Colles fascia. So urogenital diaphragm is formed by deep transverse perineal, perineal membrane and sphincter urethrae. Sphincter urethrae is present in penile urethra. Spleen extends from 9 to 11 rib. Lateral fornix is related to all except inferior vesical artery. So lateral fornix is related to ureter, uterine artery and transverse cervical ligament. Nerve supply of kidney is from celiac plexus. Portocaval or portosystemic anastomosis is seen at duodenum. Content of broad ligament are all except ovaries. So content of broad ligament are round ligament, fallopian tube and lymph node. All are branches of inferior mesenteric artery except third middle rectal. So which are the branches of inferior mesenteric artery? Left colic, sigmoidal artery and superior rectal artery. All are parts of vulva except perineal body. So the parts of vulva are labia minora, labia majora and clitoris. Blood supply of upper part of vagina is cervico-vaginal branch of uterine artery. Lymphatic drainage of testis is para-aortic lymph node. Lymphatic drainage of stomach include all except pre-aortic node. So the lymphatic drainage of stomach include right gastroepiploic node, pyloric node and celiac node. Order of the following structures of following tube from lateral to medial: infundibulum, ampulla, isthmus and interstitial. Lymphatic drainage of ovary is para-aortic. Bartholin gland are related to vaginal lateral wall. What lies between cystic duct and common hepatic duct? Lymph node. Superficial perineal space contains all except membranous urethra. So the superficial perineal space contains root of penis, urethral artery and great vestibular gland. Now head and neck. The optic foramen is located between lesser wing and body of sphenoid. All of the following statements regarding the oculomotor nerve are true except it innervates lateral rectus. So what is true about oculomotor nerve? It accommodates the eye, it raises the upper eyelid and it constricts the pupil. Cilioretinal artery is a branch of choroidal artery. The lacrimal duct opens at the inferior meatus. The weakest wall of the human orbit is medial wall. Sensory nerve supply of middle ear cavity is provided by glossopharyngeal. Narrowest part of middle ear is mesotympanum. Inner ear is present in which bone? Petrous part of temporal bone. Recurrent laryngeal nerve is closely related to inferior thyroid artery. Which of the following cartilage has signet ring shape? Cricoid. The cervical esophagus receives its blood supply from the inferior thyroid artery. Throat pain radiating to the ear following tonsillectomy is due to injury to the ninth nerve. Pain in posterior one-third tongue after tonsillectomy is due to injury to ninth nerve. Skin at angle of jaw is supplied by greater auricular nerve. The most important muscles of expiration are abdominal wall muscles. All are seen in third nerve palsy except meiosis. So what is seen in third nerve palsy? mydriasis, ptosis, and outward deviation of eye. The oculomotor nerve supplies inferior oblique, levator palpebrae, and medial rectus. Subarachnoid space ends at S2. Mandibular nerve lesion at origin involves all except buccinator. So mandibular nerve lesion at origin involves masseter, tensor pallidi, and tensor tympani. The factor responsible for viscosity of synovial fluid is hyaluronic acid. Carotid sheath contains all except phrenic nerve. So carotid sheath contains carotid artery, internal jugular vein, and vagus nerve. Secretomotor fibers to the parotid is via auriculotemporal nerve. Lesser superficial petrosal nerve supplies parotid gland. The relation of facial nerve branches to parotid gland is in the substance of parotid. The pterion correspond to the following except transverse sinus. So the pterion corresponds to the anterior pole of insula, middle meningeal artery, and lateral cerebral sulcus. Cusp of Carabelli is seen in first upper molar. Treatment of choice for subgaleal hematoma is conservative. Horner syndrome is produced due to pressure on stellate ganglion. Inferior thyroid artery ligation and subtotal thyroidectomy is done as far as possible. Which of the following are features of Horner syndrome? Ptosis, meiosis, and anhidrosis. Mydriasis is not a feature of Horner syndrome. Dangerous area of face is area drained by angular facial vein. Cassigne tubercle is at the same level as cricoid cartilage. Increased thickness of skull bone is seen in thalassemia. Which of the following anatomical landmark would be useful in defining the border of the posterior triangle of the neck? The superior border of clavicle, the anterior border of the trapezius muscle, and the posterior border of the sternocleidomastoid muscle. Veins communicating the cavernous sinus to pterygoid plexus pass through fossa of Vesalius and fossa of Ovale. Following foramina are found in greater wing of sphenoid except optic canal. So which are the foramina found in greater wing of sphenoid? Foramina rotundum, foramina ovale, and foramina spinosum. The internal thoracic vein are tributaries of the brachiocephalic vein. Isthmus of the thyroid gland is across tracheal ring, second to fourth tracheal ring. Internal laryngeal nerve supplies none of these options. Which of the following could result from a destructive lesion of the left oculomotor nerve? Loss of left pupillary constriction when light is shown in the left eye. Loss of left pupillary constriction when light is shown in the eye. Pupillary dilatation, that is mydriasis in left eye, and paralysis of the ciliary muscle in the left eye. The ansa cervicalis innervates which muscle? Sternohyoid. Which of the following statement regarding the pharynx is correct? The opening of the auditory tube is located in the lateral wall of the nasopharynx. The soft palate is at the level of separation of the nasopharynx and the oropharynx. The pharynx is continuous with the esophagus at the level of the sixth cervical vertebrae. The number of ossification centers for the hyoid bone is 3, 4, and 5. In the mediastinum, the left brachiocephalic vein passes anterior to the brachiocephalic artery. The left recurrent laryngeal nerve passes under the arch of aorta. The oculomotor nerve supplies the muscle of the eye except lateral rectus and superior oblique. So, oculomotor nerve supplies all the muscles of eye except lateral rectus and superior oblique. So, it supplies superior rectus and inferior rectus also. The posterior one-third of the tongue is supplied by glossopharyngeal nerve. Stapedius muscle is supplied by facial nerve. Which laryngeal cartilage is above glottis? Epiglottis. Premature closure of foramen ovale results in right ventricular hypertrophy, which is not true for facial artery, that it is a branch of internal carotid artery is false. What is true is main source for oxygenated blood to palatine tonsil. It supplies branches to both upper and lower lip, conveys postganglionic sympathetic nerve fibers to the submandibular gland. Internal carotid artery at the bifurcation from the common carotid is lateral to the external carotid and posterior to external carotid. Superior oblique muscle is supplied by trochlear nerve. Number of branches of the internal carotid artery in the neck is none. Inferior oblique is supplied by third cranial nerve. Damage to the internal pharyngeal nerve results in anesthesia of the larynx. Damage to the external laryngeal nerve results in loss of timbre of voice. Foramen transversarium transmit vertebral artery. The left subclavian artery is a branch of arch of aorta. Lymph from the tonsil drain into the jugulodigastric node. Middle meningeal artery is a branch of maxillary artery. The cranial nerve with the longest intracranial course is trochlear. The largest ganglion in the neck is superior ganglion. Stenson's duct opens at the upper second molar teeth. Cricothyroid is supplied by external laryngeal nerve. The cavernous sinus communicates direct with all except sigmoid sinus and straight sinus. So the cavernous sinus communicates directly with inferior petrosal sinus, pterygoid venous plexus and veins in the orbit. Main arterial supply of the tonsil is from facial artery. Main nerve supply of the palatine tonsil is glossopharyngeal nerve.